seeing one movement that is called hip extension. हम एक movement देख रहे हैं, उस movement का नाम है the extension of hip. You can see this image. When we are taking the leg to the back side, it's called extension. Extension of hip. Look at this. So this extension of hip is done by certain group of muscles. कुछ मसल के माध्यम से होता है. If we look at here, this is the gluteus maximus. ये हमारी बटक में पाई जाने वाली gluteus maximus मसल है जो हमारे हिप को पीछे ले जाने का काम करती है. It is taking the hip to the back side, so it's the hip extension muscle. And other than that, we can see the multiple muscles of the thigh. We can see here these are the multiple muscles. 1, 2, 3. So there are 3 muscles. They together are called hamstring. These 3 muscles, 1, 2, and 3. The number 1 muscle having 2 heads, biceps. 2 heads. Biceps femoris. Then semitendinosus. And semimembranosus. So 1, 2, and 3 together are called hamstring muscle. So hamstring muscle and the gluteus maximus, ये दोनों मसल मिलकर हमारे हिप को एक्सटेंड करने का काम करती हैं. So they are called hip extension muscle group. So when you want to take the legs to the front side, जब आप पैरों को पीछे ले जाने की कोशिश करते, so these muscles get contracted. You can see here. When you are taking the leg to the back side, you can see how the muscle is getting thicker and shortening. And this is the gluteus muscles. We can see how this muscle is becoming short. This is called shortening of the muscle or the thickening of the muscle. Muscle छोटी हो रही है, short हो रही है, contract हो रही है और हिप को पीछे ले जाने का काम कर रही है. So this is the hip. We can see this is the hip. So how the hip is moving, rolling to the back side, we can see here. So these are called hip extension. Now if I do the opposite movement, अगर मैं opposite movement करूं, so this is the hip flexion. In this, another muscle group is working. But if I am doing the flexion, again we can see the hip is moving to the other direction. So other muscle group are shortening. But during this time, what is happening with the muscles here? यहाँ पर जो मसल पाई जाती है उनके साथ क्या हो रहा है? They are lengthening. They are providing support. they are lengthening or they're providing support, right? For example, if this is the wire, this wire want to pull something, ये वायर किसी को पुल करना चाहता है, this want to pull my arm, so it will become short. Then you can see the position of my arm. My position of arm came nearer. Arm was here, but due to the shortening, now arm are coming closer. So who has done this work? This muscle has done this work. Now suppose I am doing something. I want to take this arm to the opposite direction. That time this is lengthening and also preventing more movement. This arm can go only till the limit, cannot go beyond the limit because this will be pulling back. This will be pulling back. So if my arm want to go, but this will be pulling back. So muscle always do two work. Number one, it contract. Number two, it prevent the opposite movement. If we want to go beyond the limit, यानी लिमिट से ज्यादा नहीं जाने देगा. Is it clear? ये दो काम है इसके. So when we are going gym, what we are doing? We are contracting the muscle. More the contraction, then you will develop the more muscle. और after completing the gym, जब जिम हम कंप्लीट कर लेते हैं, फिर हम उनकी लेंथनिंग करते हैं, थोड़ा सा स्ट्रेचिंग करते हैं, मतलब कुछ भी स्ट्रेचिंग करते हैं. बिकॉज वी हैव डन इनफ कॉन्ट्रैक्शन, नाउ वी डू लिटिल लेंथनिंग. So these groups of muscle called hip extension. So look at in this image here. Hip extension here. So hamstring muscle, gluteus maximus, and one more muscle, that is adductor magnus. These muscles are doing hip extension. If you look at here, this is the gluteus maximus. Then this one is the biceps femoris, semitendinosus, semimembranosus. Now, inner side we can see this is the muscle adductor magnus. You can see this is the adductor magnus. So these muscles are called hip extension. Now, there is a syndrome which is called lower cross syndrome. When this muscle is becoming weaker, जब आपकी gluteus maximus weak हो जाती है, तो कमर में दर्द होता है, कुछ प्रॉब्लम्स हो जाती है. The people are suffering with some group of problems. These problems, this syndrome is called lower cross syndrome. The person is becoming like this. So why it is called cross syndrome? Because cross muscle becoming weak, means your abdominal muscle becoming weak, your gluteus muscles becoming weak. हम पेट की एक्सरसाइज नहीं करते, हम कोई एब्डोमेन की एक्सरसाइज रेगुलर नहीं करते, तो पेट की मसल वीक होना बहुत ही नॉर्मल सी बात है. इट्स वेरी नॉर्मल टू हैव द वीकनेस इन द एब्डोमिनल मसल because we don't perform the exercise of the abdominal muscles regularly. And the gluteus muscles also weak. If these two muscles are weak, then this syndrome is happening. So why this is called cross leg syndrome, lower cross syndrome? Because these cross muscles are weak, and on the other side, these cross muscles are strong, tight, or we can tell tight. So the आगे की मसल टाइट है हमारे पैरों में, और हमारे यहाँ पर कमर की मसल टाइट है. So what is happening? The person is becoming like this. वो व्यक्ति ऐसा हो जाता है, right? This is the position. So this is called lower cross syndrome. I will show you in the other image. If we look at here, the muscle here are tight. These muscles are tight. These muscles are called hip flexor muscle. So this is pulling this hip bone toward this side. ये आगे की तरफ हिप बोन को पुल करती है. And abdominal muscles are weak. ये abs weak होते हैं. So they are not able to hold upward. And these muscles are tight, so this is pulling it down. So this hip bone is moving toward this side, toward the front side. ये हिप बोन आपकी आगे की तरफ मूव करने लगती है, toward the front side. This is called anterior tilt. Got it? The same thing happening to the back side. पीछे भी ऐसा ही होता है. If we look at on the back side, so these muscles are tight here. These muscles are tight. They are pulling the hip bone upward. And the gluteus muscles are weak. So they are not able to hold it downward. So again, this movement is happening. यानी हमारा जो हिप है वो आगे की तरफ मुड़ने लगता है. इसे हम एंटीरियर टिल्ट कहते हैं. ये मैं आपको पहले समझा चुका हूं एक बार, अगर आपको थोड़ा सा ध्यान हो. कुछ ध्यान आ रहा है? पहले समझाया था. So these are the hip bone, like this. So when they are the hip bone here. Like this, okay? So this hip bone is moving like this. This is called anterior tilt. Why? Because these muscles are tight, pulling it down. The upper muscles are weak, they are not able to hold. And if you go on the back side, these muscles are tight, it's pulling it up. These muscles are weak, not able to hold. So your entire hip bone is moving to the front side, turning to the front side. This is called anterior tilt. Okay. Why? Because of the weakness of gluteal muscle. So we have to remember this lower cross syndrome and which is happening because of the weakness of the gluteus muscles. So look at this image. So when there is a this lower cross syndrome is happening, these cross muscles becoming weak, and the opposite cross muscle is becoming tight, which is causing lower cross syndrome. We can see this. जब किसी फीमेल को प्रेगनेंसी होती है, when the female is having pregnancy, this might happen. Why? Because of the weight of belly, which is pulling down. That's why female are suffering with the lower back pain during the pregnancy, because of the anterior tilt of pelvis. महिलाओं को प्रेगनेंसी के समय जो कमर में दर्द होता है, उसका कारण यही है. If the female, before planning the pregnancy, if the female is developing the stronger gluteal muscle, अगर महिलाएं अपने ग्लूट्स को मजबूत बनाएं तो उनको प्रेगनेंसी के समय कमर दर्द नहीं होगा. Why the female are suffering with the lower back pain during the pregnancy? Because glutes are weak and abdomen is pulling out down because of the weight of the fetus. And also the person is overweight. जो व्यक्ति को बड़ी बड़ी belly होती है, बड़ा बड़ा मोटा पेट निकला रहता है, they also suffering with the same condition. If the person is having bigger belly, they will also be, this belly is pulling down, so they are suffering with the lower cross syndrome. The big belly means they are having weak abdominal muscle. उनकी पेट की मसल कमजोर है. So we have to strengthen the gluteal muscle, we have to strengthen the abdominal muscle. हमें ये दोनों मसल को स्ट्रेंथन करना होगा, तभी हम कमर दर्द ठीक कर सकते हैं for the patient who is having overweight. Okay. So if we talk about the muscle, hip extensor are weak. So we have to strengthen the hip extensor. हमें ये gluteus maximus को मजबूत बनाना होगा. We have to work on these extensor muscles. Hip extensor muscle, we have to strengthen them for the patient who is planning for pregnancy or who is having overweight to avoid lower back pain. So how to do that? तो पहले मैं आपको एक टेस्ट बताता हूं. This test is very much useful for finding out the tightness of the hamstring. So come back here and look at this image. So look at this action. So this is the hip extension. We are taking the leg to the backside. This movement is done by extensor group of muscle, and we know the group of biceps femoris, semitendinosus, and semimembranosus together are called hamstring muscle. ये तीनों को मिलाकर हम hamstring muscle कहते हैं. All the three muscles together are called hamstring muscle. So hamstring muscle are doing hip extension. Sometimes they might be weak and sometimes they might be tight. कभी हो सकता है कमजोर हो, कभी टाइट हो. Suppose someone is running or playing football, or due to some reason these muscles become tight. So when these big muscle become tight, again it will disturb entire region, entire area, क्योंकि ये हमारे पैरों के पीछे ले जा रहा है और ऊपर तक की मसल्स को वर्क कर रहा है. सो देयर इज वन टेस्ट. एक टेस्ट होता है जो हम पता करने के लिए करते हैं कि हैमस्ट्रिंग मसल की क्या पोजीशन है. सो लेट्स सी हियर. So this test is for the tightness of the hamstring muscle, that is called SLR test, or the straight leg raising test. इसे हम SLR टेस्ट कहते हैं. कैसे करते हैं? We are telling the patient lie down and we are holding the legs, one hand on the knee, one hand on the ankle. So we are holding the leg, one hand here, one hand here. We are doing SLR, straight leg raise test. Person can bring the leg easily by the 90 degree or maybe 80 degree or little more or less. जब व्यक्ति को हम पैर उठाने के लिए कहते हैं तो 80-90 डिग्री ला सकता है. Even at least can bring 70 degree. So this is the 90 degree. The person can bring at least to the 70 degree easily. Or maybe if the person is bringing till here, there is no pain. Normally कोई पेन नहीं होगा. But if you bring the leg and suddenly start paining, maybe at 30 degree only, till here only start pain, maybe 60 degree, maybe 70 degree. If below the 70 degree आप इतने में ही दर्द चालू हो गया, इसका मतलब ये टेस्ट पॉजिटिव है. इट्स वेरी सिंपल टेस्ट. जस्ट रेज द लेग अप. पैर को ऊपर उठाना है और देखना है क्या कमर से पैर में दर्द आता है. जस्ट रेज द लेग and see whether the pain is coming. If it is coming, it's called straight leg raising test. Is positive. Means there is a problem here. So the step number 1, raising the leg, and pain will be produced by the 30 degree, 60 degree or the 70 degree angle. So test is positive. This is the step number 1. Step number 2. If the pain is coming, suppose we are raising the leg here if the pain is coming, then we are bringing the leg little down. तो पैर अगर हम इतना पैर ऊपर ले गए और पैर में दर्द चालू हो गया, तो पैर को हम थोड़ा वापस लेके आते हैं, 10 डिग्री हम वापस लेके आते हैं. So now patient is comfortable, now no pain. Then we are telling the patient, okay, now raise your head up. This is the step number 2, raising head. Again pain produced. तो जैसे उसने सिर उठाया फिर से दर्द आता है. So this test is positive. This is step number 2. In the step number 1, we are just raising the leg and there is a production of the pain. Test is positive. In the step number 2, we are bringing the leg little down and we are asking the patient to raise the head up. Again pain is reproduced. That is the positive test. And the step number 3, again we are bringing the leg down. हम पैर को फिर से थोड़ा नीचे लाते हैं, सिर को भी नीचे रख देते हैं कि पर्सन कंफर्टेबल हो जाए. We are bringing the leg little down. We are keeping the head on the floor. So now person is comfortable. So now step number 3, dorsiflexion of the feet. अब उसके पैर को हम घुमाते, फीट को इधर डॉर्सीफ्लेक्ट करते हैं. डॉर्सीफ्लेक्शन का मतलब आप जानते हैं. The meaning of dorsiflexion is, look at this. This is the dorsiflexion movement. When we are taking the leg to the upward direction. So that is dorsiflexion. So step number 3, we are doing dorsiflexion and pain reproduced. So SLR positive. So we do in the 3 steps. Number 1, just raising the leg. Number 2, bringing leg back to the comfortable position and raising the head. So number 3, bringing the leg and head to the comfortable position. Now bending the feet. These are straight leg raise test. तो हम पता करने के लिए करते हैं, we are doing this test for finding out the tightness of hamstring muscle. So if we are doing the 30 degree, 60 degree or the 70 degree movement, so pain will be produced. This is the sign of lumbar disc herniation at L4S5 nerve roots, यानी उसको हर्निया हो गया है, कमर में हर्निया हो गया. लंबर 4 से S1, अगर आपको किसी पेशेंट के बारे में पता करना हो कि इसको दर्द क्यों हो रहा है, क्या इसको हर्निएशन है, स्लिप डिस्क है, तो स्लिप डिस्क का पता हम इस टेस्ट से करते हैं. So this test is especially for slip disc. This test is especially for herniation between the lumbar 4, lumbar 5 and S1. Is it clear to everyone? समझ में आ गया? Okay. Is it clear? Yes. तो आपको पता करना होगा, someone telling you lower back pain, the lower back pain might be because of the spondylosis, then pain will not come in this test. But if it is because of the nerve compression due to the disc problem, then this pain will be appearing. So muscles name involved or stretched in this test are gluteus maximus, then the hamstring. Hamstring means long head of biceps because there are 2 heads, semitendinosus and semimembranosus. And adductor magnus. ये इतनी मसल हमारा हिप एक्सटेंशन कराती है. So now we want to develop द स्ट्रेंथनिंग, वी वांट टू डू द स्ट्रेचिंग, हम अपने हैमस्ट्रिंग की स्ट्रेचिंग भी करना चाहते हैं. So for that we will do some certain group of exercises. Number one, towel stretch. Towel stretch तो कॉमन है, करना ही होगा. Towel stretch, one of the great stretch who is working on the hamstring muscle group and all the muscles which we discussed, gluteus, adductor magnus, as well as it's working at the lumbar 4, lumbar 5 as well. Then we'll do this recline pigeon pose. It's a wonderful for buttock muscle, gluteus maximus, and all the muscles. This bridge pose, this Adho Mukhasana, there are certain group of muscles. So we'll do now, right? तो अब हम इनको करें. So bring the towel. First we'll do the towel stretch. Then we'll do the combination of Bhujangasana, Salavasana, and Dhanurasana. All the three are very good for the gluteal muscle area. So let's start.
Sir, I have a question. This is regarding when I have done the stretch, the leg stretch fully and lift my leg up in the dog pose. The pressure comes on my thigh, like upper thigh, rather going to the hamstring.
Yeah. So because when you are taking the leg up, see, when you are taking the leg up,
my
the
focus
muscle,
has to be hamstring has to be stretched and pull and little bit painful and shivering. But
yeah, because
it
it's
is a
weak.
reverse effect.
The muscle is weak, will be shivering. See, when you are taking the leg to the back side, these muscles are doing contraction and these muscles are stretching. See, stretching.
Correct. Yeah.
So that's why you feel some you might feel the muscle are stretching and these muscles are contracting. So you might feel something front and back both. If
And
you feel
behind
the
the knee
vibration,
also.
vibration are the sign of weakness.
Acha, okay.
Wherever you feel vibration, suppose you are doing any asana and you feel vibration, means you have to do this asana regularly because your that muscle group is very weak.
Okay.
Yeah.
And the second thing is behind the knee, I'm not able to do the pigeon pose because of some varicose veins. So is it advisable to do the pigeon pose while sleeping? The full pigeon pose.
No,
Only left
it's
leg
not
is
that. That's why I use if possible. So if you feel difficulty, you just do till the namaskar mantra.
okay.
Like if
Okay.
you can do that slowly you can do. Even after a few days, slowly you can do the sleeping pigeon pose also. There is no any harm.
So if I do forcefully little bit, I'm damaging
Don't do
my
forcefully.
patches.
Asana we should never do forcefully.
Okay.
Asana we should do with the willpower. Willpower means, suppose I am telling you, hold for 10 seconds. But after 7 seconds, your body is telling, oh, enough. Then you put for 3 more seconds by using your willpower. But don't try to do forceful and jerky movement. It might get some problem.
Okay, yeah.
Okay.
Yeah. Thank you, sir.
Welcome. Yes, Rajul Jain ji.
नमस्ते सर।
नमस्ते।
आपने जो ये टेस्ट बताया था स्लिप डिस्क का, उस समय अगर किसी को स्लिप डिस्क की पेन आया हुआ है सीवियर, तो क्या उस समय करना चाहिए ये टेस्ट?
हाँ, मतलब ये टेस्ट तो कंफर्मेशन के लिए है कि स्लिप डिस्क है कि नहीं। जैसे पेशेंट ने आपको आगे बोला कि मुझे कमर में दर्द है, अब आपको पता करना है कि इसको डिस्क हर्निएशन के कारण है कि वैसे ही किसी और किसी कारण से है, तो अब आप ये टेस्ट करते हो। अब पहले से ही आपको पता है तो टेस्ट करने की जरूरत नहीं है, या फिर थोड़ा सा माइल्ड कर सकते हैं, और जैसे ही पेन उसका आएगा, टेस्ट का मतलब होता है बस एक बार, बार बार नहीं करना है, बार बार करने से तो दर्द बढ़ सकता है ना।
नहीं नहीं सर, जैसे अभी बहुत सीवियर पेन आया हुआ है और उठने की स्थिति में नहीं, उस समय करना चाहिए या नहीं करना
हाँ
चाहिए?
बिल्कुल, एक क्रॉस डायग्नोसिस के लिए कि क्या स्लिप डिस्क का ही है।
ओके, ओके सर, थैंक यू सर।
यस, यस आईफोन जी, अनम्यूट योरसेल्फ। आईफोन जी, अनम्यूट योरसेल्फ।
Sir, it's me, Selva, sir.
सेल्वा जी, हाँ।
Yes. Sir, generally you said that we should not bend the spine, right? When we do the any poses. But when we have a lumbar lordosis, so lumbar lordosis is a too much of bend in the spine. So when we do that dog pose and all, dog pose and camel pose, so what happened? When we pull your spine to the opposite side, we feel so comfortable. So in that case, is it permittable to do that pose, sir?
Yeah, so see, lordosis, suppose, what is the meaning of lordosis? When this part is curving, right? And
Yeah.
becoming like this.
Yeah.
So we can do multiple asanas together, because asana means we do whenever we are having any, like suppose someone is suffering with the spine problems. So we have to make sure while doing any asana or exercise of the spine, don't try to bend your spine like this. Try to keep your spine straight. A little bit bending will happen. Suppose I am doing like this, I am doing like this, I am doing like this. Little bit bending will happen. But we have to try to keep straight our spine. Then it will not produce pain because of wrong posture. Right? So we have to maintain. That's why I'm telling you, when suppose someone want to bend some person who is having back pain and want to bend forward like this, it will create pain. Yeah. But if you're keeping your spine straight, inhale, lift the body up, exhale, bend forward. Inhale, lift the body up, exhale, bend forward. Inhale, lift the body up, exhale, bend forward. And if the person is holding in this position, even it's a very good for back pain. It's a wonderful for back pain, but this is not good for back pain. It will produce the back pain. And if the person is having back pain, it will cure the back pain, right?
Sir.
So that's why I'm telling that we have to maintain posture. So when we do any asanas also, doing the asanas means not just reaching to the posture. Asana means by maintaining the spine in the alignment, or some body posture in the alignment, then we have to do.
So we can say it in this way, that whenever we do asana, if any pose which is very comfortable to us, which is relaxing our bone and muscles, then can we do that?
No, not relaxing. Right. See, sometimes if I am telling you, keep your spine straight, it might not be relaxing for you. Like I'm telling, bend like this. It might be, oh, why I'm doing like this? This is relaxing. Oh, I'm doing very comfortable. Even suppose someone is not having back pain, right? Someone is not suffering with the back pain, and for him it might be comfortable. This is not asana.
Okay.
Asana means put little effort. Then in the last we have to become effortless. First we have to put effort. Effort means strengthening the lengthening the spine. Then going in the final posture. When we reach in the final position, then become effortless. Then just stay there. No effort.
Okay, sir. Okay, sir.
Yeah.
Thank you, sir.
That's why asana is called Sthir Sukhamasanam. That we have to reach in the final position. We have to very much stable, and we have to feel sukha, happiness. But before starting the asana, suppose we have to put some effort. Suppose getting up in the morning 5:30, also effort. Otherwise, you will think, oh, let's sleep. I will see the recording. And person are seeing the recording of yogasana. They're taking the breakfast and looking the recording of yogasana. So see what will happen. Yeah.
Okay. Okay. Thank you, sir.
Yeah. So for the groin pain,
That's a patient.
groin pain, there might be adductor muscle we'll discuss. Adductor muscles are left. Adductor muscle means starting from the groin area. This is the groin area, right? So this is the groin area. For that, we will be discussing adductor muscle because we are discussing one by one abductor, extensor. So when we are going to discuss adductor muscle in the groin muscle, that time we will discuss about. Thank you so much.
Thank you, sir.